Welcome. This is Dr. Hugh Wegwerth. I'm a functional medicine doctor, and today what I want to do is go over actually a case study of one of my patients that had major brain problems, brain fog, shaking, and a whole bunch of other different things. So I want to go through this as quickly as possible just so you kind of get an understanding of what a functional medicine workup looks like in my office. And if you have brain degeneration, Alzheimer's disease, memory problems, shaking, you can actually get better. Within this page here, you can actually see a testimonial of Jill. So Jill, that's her name, she's 51 years old. These are her major problems: thyroid, digestive problems, pain, sexual problems. And then while we're talking, this is a major thing, is she started having tremors, hand shaking, brain fog, memory problems, not remembering names, dates, important things. So let's just kind of go over some of her things here. She wants help with all these different things: sleep, digestion, constipation. She feels frustrated. She's been to over 20 different doctors. She feels like she's 100 years old. She feels like she's going to lose her freedom. She thinks in 3 to 5 years she could possibly be dead, which is, this is a serious problem here. This is a problem that she has. This is some things that she would actually like to accomplish. In 3 years, she'd actually like to have a physical relationship with her husband. Right now, she's in so much pain, they can't be intimate together, and that's a big problem with their relationship. So a functional medicine program, we're going to take a look at her whole body and figure out what's actually going on. This is some other paperwork that I have people fill out. This is, again, Jill. And here you can see category 1, this is the colon. This is the integrity of the intestinal system, and we rank it 0, 1, 2, and 3, 3 being the worst. And you just kind of want to look at how many plus 3s this woman actually has. Look at all these 3s on. Let me move up here, page up. Let's go to the first page here. So, for example, here, like intestinal problems plus 3, stomach plus 3 right here, swelling and distension after eating, stomach acid plus 3s here. Use antacids, that's a bad sign. Indigestion, fullness after 2 to 4 hours after eating. So these are just signs where you just kind of want to look at this and say, hey, there's a lot of systems that are messed up. Biliary gallbladder system, look at all these 3s, losing weight, skin problems. So what this is really designed to do is give me an idea. This is your liver here, liver problems. Sugar utilization, she has some insulin resistant problems. She's she's pre-diabetic. Here's your adrenal gland, not enough adrenal glands, adrenal fatigue. She has that going on. She has thyroid, look at the thyroid plus 3s. She has hypo, not enough thyroid symptoms, and hyper. So she's got both happening right here. Just things are just falling apart here. And then if we move over here, look at this is she had a hysterectomy. Look at all these 3s right here. So she's not doing well. She's looking for some answers. Let's get into the blood work. We take anywhere from 11 to 14, 15 vials of blood. Then we put it in this report. You get a 24-page report. And anything that's in clear, this would indicate where normal, healthy human beings should be. Anything that's in yellow here indicates it'd be like a piano string that's out of sync. So imagine if you're a piano string, you have 80 pianos, and right here she has 12 plus 7. She has 19 strings that are out of sync. So this means that her body's not functioning optimally. She has 6 plus 5, she has 11 strings that are broken, and then she has 6 alarm states right here, which means that these markers are really, really high. So we get a good picture. I'm not going to go over every little nuance on this. I'm going to kind of hit the highlights. Fasting insulin. Now, when we talk about the brain, insulin is a hormone that will dissolve the brain. It starts to degenerate the brain. So there's no drug that's going to reverse Alzheimer's disease or dementia or restore your memory. You have to take a functional medicine approach. And a functional medicine approach, you're looking at multiple different things. When it comes to blood work, we're figuring out why your body's not functioning, why your brain's not working correctly. So some highlights here. This is super high. This is the optimal range right here. We want to see this between 2 and 5. This would be the standard medical range. So on a functional level basis, we're looking at where are these markers, where do we want these markers at on a normal, healthy human being. So All the things that's in white here, these are normal, healthy human beings. So you can just like look at this and you can see like she doesn't have a lot of white markers right here. Some of the highlights, of course, are this fasting insulin is quite off, potassium's off, uric acid. I don't know if you've heard of gout, but that's an inflammatory marker. Anytime you're inflamed, your brain is going to start to degenerate and decay. Alkaline phosphatase here. You need zinc in order for this. In order for this number to be a healthy number, which is over 70, you need zinc. So just tell me that she doesn't have enough zinc in her body. Ferritin is an iron marker. She is anemic. She can't be classified medically. So she has anemia. She's had long-standing anemia for, I would have guessed, 20, 30 years. No one's addressed this. What do you need? What do you need iron for? Well, iron delivers oxygen to your brain. If you don't have enough iron, you don't have oxygen delivered to your brain. You don't have oxygen delivered to your heart, your liver, your muscles. You just don't feel well, right? So she was suffering from anemia for 20 years, never addressed, never figured out. Triglycerides, look at this, are 770. We like to see this less than 100. That tells me that her diet is severely not working correctly. CRP, this is an inflammation, a marker of inflammation. Here's a marker of inflammation. Homocysteine is a marker of inflammation, and DNA replication, meaning that her DNA that is born in her body is very poor quality. Your DNA is what tells the cells what to do. Her vitamin D is not optimal. I like to see that around 100. You can see here, these are some more markers of anemia. You can see how they're in the red and the hot pink, severely bad. And again, she had anemia for 20, 30 years, but no one actually discovered it. No one figured out that she had an anemia. And what I find with a lot of people that have brain problems, dementia, Alzheimer's disease, foggy thinking, brain fog, is they don't have enough iron in their body. Here, this is markers for digestive problems. And then down here in this report, it kind of summarizes the highlights. So if you write fasting insulin, she's insulin resistance. In here, this ESR is an inflammatory marker. I just highlighted some stuff here. Uric acid is a B12 folate deficiency. CRP is an inflammatory marker. Lymphocytes is your body's inflamed. Down here, this marker is an inflammatory marker. Homocysteine is a B12 absorption marker. All this, we're getting this from the blood work. Hypochlorhydria, which means that you don't have enough HCl in your stomach. You need HCl, which is hydrochloric acid, to digest food. Hemoglobin, anemia. See, so these things need to be addressed. Iron serum, again, anemia right here, anemia. Why do you have anemia? Because you don't have good absorption problems. You're not absorbing well. Vitamin D, depression. She had brain fog. She has shaking, chronic inflammation. Again, MCV here, B6 deficiency. Ferritin, poor iron storage. I mean, this stuff goes on and on. Bacterial infections right here. So when you look at a functional medicine workup, you're actually looking at you as a whole human being and figuring out what's going on. Another anemia, iron deficiency, alkaline phosphatase. Some other tests that we did. This is a food sensitivity testing. So you want your food to be 1 here or in this area right here. So anything that's above that tells you that you're sensitive to that food, meaning that that's going to cause chronic inflammation. Anytime you have chronic inflammation, that's going to set your brain up on fire. When your brain's up in fire, you're going to be prone to Alzheimer's disease, Parkinson's disease, dementia, forgetting, brain fog, brain fatigue. All these things start to come up when you have this inflammatory marker. She's sensitive to eggs, egg yolks. This is a blood test that we do in the office. It's a little finger prick. Baker's yeast, which is in bread. Move down to the second page. Whole wheat she's sensitive to. Then we went to check her adrenal glands right here. So you want to have your adrenal glands, which are these glands right above your kidney. This is where you want your adrenal glands to be. So this black line is where she's at. So she's flatlining. She's having a basic heart attack when it comes to her adrenal glands. The morning cortisol, which is this right here. We want her marker is 4.3. Optimal is 18 to 35. Research shows is when you have this kind of pattern down here, this is going to cause brain degeneration. When you have brain degeneration, you're going to be more prone to dementia, Alzheimer's disease, brain fog, brain fatigue, shaking, balance problems, all these things that are happening. So that you can just see this is the optimal range right here, and this is where she's at. So this whole thing is bad. The night cortisol is 9.5. You want to see that 1 to 4. So her whole cortisol levels, you do this is a saliva test. You do this morning, noon, evening, and at night, at home saliva test. So what we're actually checking here is her brain. When you have bad cortisol levels, it tells you that your brain's not functioning right. Down here, this is a marker that we check here. And you can see right here, I kind of highlighted this right here. This is a test for inflammation, immune or inflammatory marker. This checks your gut. You want this between 75 and 330. She's at 4,900. So her whole body's chronically inflamed. Her brain's inflamed. We also check the hormones, the estrogens. You have 3 estrogens, progesterone, testosterone, and DHEA. Progesterone is 13. Here we like to see this between 5 and 3,000. So she doesn't have enough progesterone. Her estrogen, we like to see this between 1.5 and 7.2. Ladies, you need hormones. You need balanced hormones for your brain to function. If you don't have hormones, you're not going to function. DHEA is 13, which is way low. We like to see this. I like to see this around 250 here. So you need to put these hormones in balance. Once you get these hormones in balance, your brain starts to function better. Right, here's some symptoms that she has. This is the things that she filled out. Again, 0, 1, 2, 3. And you can see how many 3s that she has here. So what did we do to help her? So this is her exact plan. We did food elimination. We put her on iron supplements. This right here, berberine, is for the gut. She has leaky gut. Based on the food sensitivity testing, her leaky gut is not doing very well at all. We put her on vitamin D. We put her on HCl capsules. I had her watch a video right here. These are videos that I have people watch so they understand, so they can get education. This is an HCl video. I had her watch a video on wheat and the pitfalls of gluten-free. I put her on probiotics, and I told her to watch my video on heartburn. I have a whole series on heartburn medications and how those, and I have a whole series on heartburn medications and how those are really cause a lot of havoc. So here, let's just go up to the date right here. So you can see the date is 3/11, and then she came back. She came back right here, which is 5/16. And I'm just going to kind of summarize. Basically, she's gotten her life back. Her complexion much better, lost 30 pounds, more energy, sleeping better, moving better. This is key right here. Shaking much better, more stable and walking, thinking clearer, less brain fog, much better pain. Her pains are gone. They're having sex twice a week. The GI system, she's going to the bathroom. She was making a bowel movement 3 times per week. Now she's making 1 to 3 bowel movements a day. She doesn't look like she's pregnant. More endurance. She's cleaning the house. She saw 20 different medical doctors before she seen me without any success. No more cold hands and cold feet. She has more energy. So this is what's possible in a functional medicine program. So there's no doubt that you can get help. If you want help, you can just click the link and schedule an appointment. Take care.